Do you think there's any chance that if you were to inhibit myostatin, you could potentially get increased muscle mass to the point where you increase the probability of injury?
Oh, absolutely. And I mean, again, I think that's not going to be unique to follistatin, right? I think anything that preferentially increases muscle mass, maybe muscle strength, without corresponding improvements in ligaments, joints, bone, right, could predispose you to injury
Mm-hmm.
because your supporting materials aren't going to be able to withstand the stress that's put on by exerting the muscles to their maximum potential. Yeah.
Because the muscles go up quicker and then the bones and ligaments can't keep up.
Right.
Okay.
Right. Again, I don't know that's the case with follistatin. I don't even know if people have really looked at that.
Mm-hmm.
But in general, things that would just specifically increase muscle mass and function could have that effect.
I could be wrong, but I've heard the cows are pretty unhealthy. I mean, they look really big and muscular, but they're short-lived.
Absolutely, yes. And I mean, I think this is the difference as well. Those animals have an inborn mutation, so they go through development. So they go through development and all of adulthood with high levels of follistatin. So that is not a pro-longevity strategy in that context. I think the question is this sort of approach where you turn up follistatin maybe transiently during adulthood a pro-longevity strategy? That's a different question. Again, very little evidence to support that, with the exception of the one mouse study. And again, to me, that's why it just seems really premature to go right to gene therapy for this thing, right? I mean, again, when you think about this from a risk-reward perspective, like the rationale where there's one not very high quality mouse study on the plus side, and a bunch of questions about safety on the minus side. And we've talked about, does the therapy work? Even if it does, what are the negative consequences from high levels of follistatin? We just talked about injury as a potential one. There are a bunch, right? There's all sorts of unknowns just from the potential downsides from increasing follistatin expression. Then there's the questions about the company itself, the technology they're using, the manufacturing and purification processes. To me, that's the real red flag here. And that's the real concern about this medical tourism going to these, secret islands, right? You really have very little information about the quality control that goes into the purification of the products that are being used. It's the same thing's true with some of these stem cell therapies that are done offshore as well. So what are they actually putting into your body? You really have to trust them, right? How was it purified? And look, I've even in the best labs in the world at the most reputable institutions, I've seen some pretty bad plasmid purifications, right? So, one of the things, and look, I'm not a huge fan of FDA, don't get me wrong. One of the benefits, though, to go through the FDA process is that they require companies to follow good manufacturing processes, good clinical processes, to high standards, right? You don't have that with these sorts of offshore organizations. And so you have to trust them. And so the question is, and this is what I would pose to people, like I have no idea where he's getting his advice from, but after watching this video and seeing it, like, ask yourself, do you trust these people enough that you trust them to do it right, to make sure there aren't any impurities and to put this stuff in your body? That's independent of whether the therapy itself has a positive risk-reward profile, right? This is a completely different question. And I will say, I mean, I think, again, I personally would be in favor of a way that these types of therapies could be offered in the United States with some regulatory oversight. Like, I think this has been a big problem in the stem cell therapy world, right? Because the FDA has just said no, right? You have a lot of people going offshore to get these stem cell therapies. There's probably benefits for at least some people from these stem cell therapies, but we don't have a lot of assurances around quality control. If there was a mechanism where you could have these experimental therapies available to people who have, consented, who really want it, with some regulatory strategies around quality control for the manufacturing process, the clinical care that these people are getting, I think that actually would be a good middle ground. And maybe we'll get there at some point. Right now, unfortunately, though, we're in this place where people who want these kinds of experimental therapies have to go offshore, where I'm not saying that everybody who's doing offshore medicine is shady. They're not. There are some really good practitioners out there, but there are also some shady characters out there, and it's hard to know which you're dealing with in a situation like this. So, I mean, I think it just is that to me is a big challenge when you're trying to evaluate the risk reward for something like this. I would say personally, even if there was a small molecule that I was confident could increase follistatin, based on the data that I've got today, I wouldn't say the risk reward favors taking that small molecule, even if it was FDA approved and we knew something about safety, right? Given that it's not FDA approved, you have to go to this, offshore clinic. To me, it just doesn't make any sense. And again, that's why I say I really have to wonder, like, where is this guy getting his advice? Yeah. Honestly, it feels almost like desperation to me.
Really?
I mean, I just can't imagine why a rational person, clearly he's got a lot of reasons to want to, continue to optimize his health.
Yeah.
It's just hard for me to understand why. And again, maybe I don't have all the information, but why you would come to the risk reward analysis that if your goal is to not die, right? Your biomarkers seem to be going the right direction. You would do something like this that at best is going to incrementally move the needle. He might see a positive change in body composition, but the risks that, go along with that, I don't know. And again, you could also say there are lots of drugs that show positive changes in body composition that we found out are really harmful, right? I mean, look at anabolic steroids.
Yeah.
Not that those are really harmful, but they definitely have some downsides to them, right?
Yeah. Fat burners, stuff like that. There's been
right. Dinitrophenol, right?
Yeah.
Lots of people died from that. It got pulled, right? So I don't know. It just doesn't make a lot of sense to me. And I can't, again, I don't know anything about this guy's situation, but I can't help but wonder if this is one of the consequences of, the sort of marketing approach that's been taken here. And, you kind of have to get bigger. When you get bigger, you have to get a little bit more extreme. Like, where do you go from here?
Yeah.
So you did gene therapy on a secret island, right? What's the next step?
Well, his video after this was stem cells. Funny enough, you mentioned that, but which actually seems potentially a little bit safer and more researched.
Certainly, I think there's more evidence for beneficial effects. I think you still have the issue. And I think there are enough of these offshore clinics where they've been vetted a little bit. At least if you go to the top ones, you can be pretty confident. There, though, you still have that issue of they're working outside of the regulatory environment in many cases. And so you don't necessarily know what you're getting, how well it's been purified, how well it's been vetted. Is it really what they say they're giving you? I mean, again, maybe I'm not trusting enough, but I just have a lot of skepticism around these organizations that operate outside the law.
Yeah.